Can you tell me about this pertussis breakout, this whooping cough breakout? What's kind of going on?
So there's been an identified increase in pertussis cases here in the western part of the state, predominantly, really over the past week or so. And pertussis is a severe respiratory illness that can cause a really bad cough, especially in kids, and it can lead to things like pneumonia, seizures, and swelling in the brain or encephalitis if it's not treated promptly and identified. And it's called the whooping cough because it causes a very characteristic sound of, kids will have a severe coughing fit, and then in between those coughs, when they try to catch their breath, it makes a characteristic whooping noise, which is usually the indication that they need to seek medical care and get checked out. It's incredibly contagious, and unfortunately, we haven't seen a lot of this in West Virginia for a long period of time because we have had very good childhood vaccination rates. But West Virginia is not immune to the national trend where we're seeing a decline in overall in childhood immunization rates. And so we are seeing a resurgence of diseases like pertussis and measles across the country, but here in West Virginia as well, that we haven't seen in the past few decades.
Do you know how many cases have been reported in the last couple of weeks?
It's evolving and it's continuing to change. So I don't have the accurate number off the top of my head. I know that there are new cases every day, but it still remains to be seen if this meets the criteria for an outbreak or not, depending on the number of cases, and that will be determined at the state level and by the local health departments.
But it's enough to cause concern.
Any case of pertussis is concerning because it is so highly contagious, and so anyone that has any symptoms, and early on they could be very mild symptoms like just cold symptoms that then progress to a severe hacking cough, needs to be checked out, and I would encourage everyone who has concern to contact their healthcare provider. Certainly call before you go so that they can give you any precautions that they may want to institute, like masking or waiting in the car to get tested or things like that. But as cases increase, we certainly have a higher level of concern to make sure that we can do appropriate contact tracing and really nip this type of infectious disease in the bud, because it is so highly contagious and is predominantly focused or selective for younger kids, people who are unvaccinated, or people who have waning vaccination rates after waning immunization or rates as they get older.
Why are we seeing this? Why is it more prevalent now than in years past?
Pertussis has always been around. Even in 2023, we had around 26 cases here in West Virginia. But generally, they're sporadic. They're isolated because we have such a good herd immunity rate and such a high vaccination rate here in West Virginia. Since COVID, the COVID pandemic, we have seen a decline even in childhood vaccinations for things like pertussis. And so we're seeing a slow but steady decline in that herd immunity rate. And so if vaccination policies are relaxed, either at the federal level or the state level, we can expect to see more cases like this, where we have multiple cases, either clusters or outbreaks of preventable diseases like pertussis and measles that generally affect the most vulnerable kids among us.
What is important for parents to know? What should they be concerned about?
It's important for them to know that if their kids have symptoms, that they should get checked out. It is treatable with medical attention and antibiotics, which is good for those kids that do have symptoms. There is also prophylaxis and preventative medications for kids that are exposed or have concerns about exposure. For example, if someone in a school gets pertussis, their close contacts can go to their healthcare provider and describe that contact, describe the symptoms, and antibiotics can be used to prevent that child from getting pertussis as well. So there are things that we can do to help manage this and to keep it from spreading. But it's important that families coordinate closely with their primary care doctors and providers to make sure that they're getting the best recommendations in their circumstance.
Okay. Now you said that there is a cough that is associated with this. What other symptoms should parents be looking for?
So pertussis really comes in 3 stages, and it can last upwards of 3 weeks or more. But the first stage is fairly nonspecific. It can be runny eyes, runny nose, mild cough, fevers, chills, those types of things that we might see with other cold-like circulating viruses. But then it will change fairly abruptly and will turn into a really bad, almost it's been described as a violent hacking cough. And in between that cough, you will see the child or the infected person have this whooping sound to try to regain their breath. That's really when it becomes characteristic of pertussis and something that parents should really have on top of their mind. If they hear that sound, that's really kind of the indicator that they need to get checked out. Also, if they're a first-degree contact of anyone who's been diagnosed, they should get evaluated as well. But the third stage is really the resolution stage, and for kids that don't have more severe symptoms, it can resolve on its own after a period of weeks or months, even sometimes. But the most important thing is that whooping cough, that characteristic inhalation sound in between these really severe coughing fits.
Is there any precautions that parents can take to prevent their child from getting out? I know you mentioned the vaccine, but is there anything else that they can do to prevent their child from getting whooping cough?
Well, I'm going to mention it again. The vaccine is the most important thing. It's safe, it's effective. It'll cause your arm to be sore and you might feel a little cruddy the next day. But it's worth it for the peace of mind to know that your kid isn't going to have the severe symptoms of pertussis, which can be really, really bad for some kids. Thankfully, we have treatments that can help if kids do get pertussis or are exposed. But those are the main symptoms, the main indications really, is to make sure that kids are getting vaccinated, that they're and using standard precautions. If they are feeling ill, stay home, isolate, try to stay away from others that are feeling sick. Generally, things that we recommend during this kind of respiratory season anyway, where there are lots of other circulating viruses, even like flu and COVID and RSV and others. If you're sick, stay home. Keep everyone else around you healthy and safe.
Is there anything else you want to mention that you think is important that I didn't ask you?
I think it's really important to remind parents vaccination is the most important thing to do to keep kids healthy and safe. It's safe, it's effective. If you are concerned about your symptoms or your kid's exposure, make sure that you're getting checked out by your primary care doctor.
Thank you so much, Dr. Christianson, for your time. I appreciate it.
Great, thank you.
Bye-bye.